Good evening. Welcome to tonight's program. I'm Kelly Wright. And of course, we're talking about the COVID global 19 pandemic in today's show. And of course, my opening observations deal with this same situation. Here we are. We're doing our level best to get through this. And yet, this is a virus that knows no color, yet it impacts African Americans adversely. And that's because of our health disparities. We have to learn to be accountable and responsible for each other and to help each other through this crisis. We've got to take better care of ourselves and each other. And then on tonight's show, you'll see how we can reach out and touch each other through social media platforms. As I've stated on this show before, while we are distancing ourselves from each other socially and physically, we cannot afford to isolate ourselves. If there's a way we can help somebody, we got to do it. And you'll see that in tonight's program as well. So let's get on with it. Let's talk about it. Those are my opening observations. Let's get on with the program. Our first guest on the program tonight is Jack Brewer. He, of course, is the NFL great Jack Brewer. And Jack, there are too many teams for me to list, but I think it's the Minnesota Vikings, the Philadelphia Eagles, the Washington Redskins. Who have I left out of that mix?
Well, actually, not the Redskins, the Giants. So I had
Giants. Oh man, I went to the Redskins. But to all of your accolades in terms of playing in the NFL, you're also an important player in America right now, helping a lot of people through this COVID-19 pandemic. And you're very valuable to the RNC as it relates to the Trump administration. So the president has announced, Jack, that he is creating a revival, an economic revival, and he's calling on all the top CEOs, and many have joined him in this. And he's going across every sector and strata of the American economy, and even thought leaders like Condoleezza Rice and K. James Cole. Tell me about this effort and if it really makes an impact going forward.
I mean, it really exemplifies what this president is all about. He doesn't come and approach these type of issues like a traditional politician. I mean, for him to be able to go out and get, the top people in defense and agriculture and energy, retail, technology, across the aisle, really, a lot of these CEOs that are coming on board don't necessarily agree with everything that this president says or does. But everyone has the common goal of getting America through this crisis. And I think that is what really at the core is so revealing. It's so revealing about his leadership style, so revealing about his use of his experience of being a CEO. I mean, Donald Trump owned over 500 different businesses. And so he really understands, how various industries can cross over and, which companies can step in right now and give and offer him advice. So, I think it's really revealing. And I think what he's doing is the right thing because, if he went and approached this trying to make all of the decisions himself, that may be very difficult. But when you have, key opinion leaders in every sector across this country really coming together and partnering for the greater good, I think it's a powerful move. And I think it'll help us really accelerate our growth after we get through this coronavirus.
I'm talking to Jack Brewer, who is a member of the RNC as well as an advisor to the president. And Jack, I'd like you to stay with me for the next segment. On the other side of this break, I would like to talk to you about what you're personally doing to help people who are in dire straits because of this COVID-19 pandemic. We'll be back with more of Jack Brewer after this. Back now with Jack Brewer, who of course has worked with the president as well as the RNC, the Republican Party. And Jack, looking beyond politics, I know that you're actively engaged in helping people throughout this COVID-19 pandemic, from Africa to Haiti to the United States. How's your program going in terms of getting more PPE, and getting more food distributed to so many people who are in need because of this coronavirus crisis?
It's been going really well. I'll start off with our work in Africa with my foundation and my partners on the ground. My staff and team there are assessing everything on the ground. Luckily, in Malawi in particular, the region that we are headquartered, we haven't been hit so hard. The disease hasn't really spread there a lot. We don't have any deaths as of yet, but we are prepared, and we're preparing. We have our orphanages prepared, and we're making sure that we have things like food and water available, because those are the biggest issues. When epidemics like this happen here in America, we have enough food supply and our supply chains are pretty well put together. But in countries like Africa, if you have a shutdown where the government can't allow flights to come in, you'll have fuel surges. You'll have surges that will cause the entire supply chain to break down. And these folks are going to get their food on a daily basis. They don't stock up their refrigerators for a week or two. They go on a daily basis. So this can really crush an economy. It can cause major famines. And so we're trying to do whatever we can to avoid that. We feed about 15,000 kids a day in our orphanages and programs. And so, we're just doing whatever we can now to make sure that those kids will be okay. And in Haiti, it's very similar. In Haiti, we were able to get out in front of this. Once we saw that, we started doing so many shutdowns here, I was able to go out and secure food for about 2 months for all of our beneficiaries there. And so that really helped us. But, the country at large isn't doing so well, even before this coronavirus, with the political unrest. And so, in a place where you have, so much political instability, when you throw in a pandemic like this, it's not good for the people. And so we really are lucky to be here in America.
And it's affecting our community in a very devastating way through loss of life. Then there's loss of jobs, loss of income. What can be done to address the specific needs of this particular community?
First off, we have to be real with ourselves. We got to wake up. We can't look for other people to help us right away until we help ourselves. And so what I mean by that is when I get in my car and I drive through Black areas and I see people outside congregating, no mask on, playing basketball, shooting dice, playing dominoes, acting as if nothing is going on, then you understand why we're getting all of our mothers and fathers and grandparents sick. Like, we really got to take it upon ourselves first. And, it's been disturbing. I must admit, Kelly, I go into these communities and I also have friends that are going in, checking on people, trying to look out, for Black people. But we gotta wake up. We know that we have higher rates of diabetes. We know we have higher rates of high blood pressure. We know we have higher rates of obesity. We can't fix those problems overnight. Those are cultural, right? We eat different foods. We may not have the same level of health as other demographics. We can't fix that overnight. But we are smart enough to know that even though we may be more advantageous to get this virus, if we stay in the house and listen, we won't get it as much. And so I think it starts there. Before I start looking out, I want to look in.
And sadly, there are reports that some people are dying in the house because they've not been tested. They've had the coronavirus and they've been dealing with the illness, not even aware that they had it. And so we have a problem, and we've been sounding the alarm here on the program about how this would impact our community, but also talking about the things that we have to do to take ownership and responsibility and accountability for our own behaviors, like having kids outside playing without any mask. I know my wife and we drive through a neighborhood, and the neighborhood is quite mixed ethnically, and yet we've seen people, Black, white, whatever, walking around without masks, when the governor of the state of Maryland has actually issued an order: whatever you do when you go outdoors, wear a mask. It's for your own safety. So we in America still have to get it right in making sure that this is real, and then being proactive about taking care of it. But Jack, there's so much more that you and I could talk about. So you got to come back on.
Anytime.
I'm glad to hear about the progress that you're making in getting the PPE that's so needed, not only for our health workers, but also for the people in general. And then I'm definitely delighted to hear what's happening in Malawi. Before I let you go, we were talking just before we went on about the news reports, if it's innuendo or if it's real, about how Africans are being treated in China, being kicked out of restaurants and places because of this COVID-19 pandemic. What are your sources telling you?
Well, I got pretty upset when I read the article. So I reached out to some of my partners on the ground, folks that I've been working with for almost 2 decades, and just to check it out. I always check and run my stories by the folks on the ground. And according to them, they said that particular story about McDonald's was not true, because they said everyone, Chinese, black, white, whatever color you are, McDonald's is not allowing anyone to come in there and eat. And they said they called around and they don't think that story is true. Now, if it's happening in other places or other situations, they said they couldn't tell us about that. But they said that particular situation, McDonald's has shut down, and the government in China has asked that no one can come in and actually sit there. You have to only do pickups. So they're not allowing anyone inside the store right now in China because they are seeing a little uptick again of the virus.
Well, thanks for bringing us up to date on that point as well. And as always, you're welcome on the program. Jack Brewer, good to have you today.
Thank you so much, Kelly.
Thank you. God bless you.
God bless you.
I'm talking now to Dr. Yolandra Hancock. She is a pediatrician, but also works in the public health sector. And Doc, we're hearing now some other disturbing news about this coronavirus. And that's the fact that many people are dying at home without ever knowing they had the coronavirus. What does this suggest to us? Does it suggest that we don't know the full number of fatalities from this virus?
Absolutely. I think one of the biggest concerns about folks dying at home is that, one, we won't have a clear understanding of the widespread infection rate for COVID-19. We won't have a clear understanding of the full impact of the pandemic when we are not accounting for these individuals who are dying at home. It also speaks to concerns that we have had since the beginning of this pandemic as it relates to massive widespread testing. If we're not testing individuals to identify that they have COVID-19, they aren't necessarily going to be able to recognize the symptoms that are being manifested as a COVID-19 infection. When we know that COVID-19 can cause anything from an asymptomatic infection to fever, cough, and shortness of breath, and everything in between. Some folks are only developing loss of taste and smell as their symptoms for COVID-19. Some folks are developing gastrointestinal symptoms like diarrhea and nausea. One of the biggest concerns is that these nondescript symptoms can then progress to more severe respiratory symptoms. And folks, until they've developed shortness of breath, they may not necessarily recognize that they need to seek out medical attention.
So again, it boils down to the testing then, doesn't it?
It really does. I think certainly when you think about things in hindsight, one of the differences between us and our country versus a place like South Korea is that South Korea hit the ground running. They compelled companies across the country to focus on testing. They were testing folks at 20,000 residents per day. We didn't get to that number till several weeks into the pandemic. And even now, it's still a struggle to appropriately test individuals.
So if I wanted to go out and take a test today, it's not that simple.
It isn't. Most healthcare institutions are still following the relatively strict CDC guidelines. Of course, the CDC guidelines change as the pandemic grows, but it's still fairly restrictive. I'll give you an example. There was a young man that I took care of just a week and a half ago who works at one of our local grocery stores. Now, we just lost someone to COVID-19 who works in the same grocery store where he worked. But because of lack of healthcare insurance, he wasn't able to be tested. And because where he presented, he did not fit the diagnostic criteria or the risk criteria for COVID-19, he was refused testing. Instead, he was treated for pneumonia and sent home on a 5-day Z-Pack. there are two reasons why that's very dangerous. One, when you diagnose someone with a standard bacterial pneumonia, the time of isolation doesn't exist, right? We usually recommend if you feel better after 24 to 48 hours on antibiotics, you're free to go back to work. But in the face of COVID-19, if it was truly a COVID-19 associated pneumonia, I would tell him to stay home for the full 2 weeks. Because he didn't have insurance, that limited his access. Because he didn't have the risk factors, that limited his access. Instead, I screened him for free and referred him to a testing center where he was tested. And I mean, that speaks to several issues here in the United States. One, issues related to insurance, but also even more importantly, how we're still limiting the capacity to test based on strictly following the CDC's criteria.
That is so alarming, the fact that many of us could be walking around asymptomatic, as we've seen. And that is another reason why so many states, the governors of those states, have demanded that people wear protective gear. You've
Right.
talked about this on this program over and over and over again. And somehow, Doc, we just are not getting it.
Right. I think part of it is the mixed messages. You know, when we first started out with COVID-19 back in January, recommendations from the CDC, from the Surgeon General's office, were that people did not have to wear masks. And that in actuality, wearing a mask actually put you at higher risk. But very savvy communities understood the conflict in terms of the information that was given out. Healthcare providers were encouraged to wear masks, but your everyday consumer was not. The message was not straightforward or well received because it didn't make sense to a lot of people. I've gotten a lot of feedback from folks saying, well, Dr. Hancock, this doesn't make sense. The CDC is saying not to wear masks, but people across China clearly are. Now, with the recommendation from state to state that people should wear masks on a regular basis, folks are still questioning that recommendation, particularly given the fact that every single day data comes out new about COVID-19 as it is a novel virus. Initially, it was thought that the particles remained in air for 3 to 4 hours, but did not travel. Now, based on data coming out of the National Academies of Science, there's concern that it now is aerosolized, which reinforces the need to wear a mask. But I think, Mr. Wright, it's important to understand that not all communities have access to masks. So it isn't even a matter of stepping up and putting your mask on. It's really asking the hard question, does everyone across America where the mandates are being passed, do they have access, resources to either purchasing or making a mask? That's something that we also have to address when we're pushing out these mandates.
So alarming and yet so illuminating for you to bring us the illuminated truth here on the show. And I'd like you to stay with us for the next segment to talk more about your concerns for African Americans and your concerns for the medical residents who are being called into harm's way on those front lines of helping people deal with the coronavirus. We'll be back with more of Dr. Yolanda Hancock right after the break. Welcome back to the program. Again, my guest is Dr. Yolanda Hancock. She's a pediatrician and also works in the public health sector. And as a result of that, she is all too familiar with all the data about how COVID-19 is impacting African Americans in an adverse way, disproportionately to the rest of the people in our society. And Doc, let's be clear here. The coronavirus doesn't really know any color, yet because of our propensity to have different kinds of illnesses, respiratory illnesses, it leads us into this danger zone with the coronavirus once we're exposed to it. Can you further explain, please?
Sure. There are several reasons why communities of color are disproportionately affected by the COVID-19 pandemic. One of them, based on what you just said, prior to COVID-19, we clearly saw these health disparities. These health disparities, particularly among African Americans, have existed since the inception of the United States, really coming out of slavery, Jim Crow, the civil rights movement, and even today in terms of some of the institutionalized racism that we see in how chemical plants are placed in communities of color, our lack of access to healthy foods and safe space to engage in physical activity. I always say diabetes, hypertension, heart disease, and obesity don't develop in a bubble. They happen based on where you live. It's all about the social determinants of health. Your health is defined by where you are born, learn, live, work, play, pray, and age. Your zip code is more important in terms of your health outcome than even your access to a healthcare professional. All of those that I just mentioned, where you live, work, play, age, are 80% of what attributes to your health. Access to a healthcare provider is only 20%. The other part of why African Americans and Latinx communities are at higher risk is that we make up the majority of the hourly wage workers who are keeping this country running. We are the ones showing up at grocery stores, in the hospital to work, in the administrative departments, in the food delivery service. All of those frontline workers, a majority of them are people of color. And we're having to crowd into trains because transportation is an issue. And a friend of mine just sent me a picture about a week ago of the L train in New York, which is the epicenter of COVID-19 here in the United States, and the train was packed. This is just last week. Because communities of color are dependent on public transportation, and we know bus routes were reduced, it's no surprise that even in New York, we're seeing the largest percentage of people affected by COVID-19 are our Hispanic population. Communities in places like New Orleans and Milwaukee, it's predominantly African Americans who are the cases and who are dying from it. And it's really based on the health disparities that existed before COVID-19, not just in terms of our physical health, but our financial health, our educational health. All of those factors are at play in terms of our increased risk.
There's so many things that we have to address as we go through this. And one of the things that you've been addressing is the fact that so many medical residents, people who are close to graduating with their degrees in medicine, are not really ready for the front lines because they're not protected. And you are drilling down on that and becoming an activist engaged in trying to protect a lot of young doctors. Tell me what's happening with that.
Absolutely. My biggest concern is that recently graduating fourth year medical students and physicians who are just in their training are being pushed to the front lines very prematurely. They're eager to help. They're eager to serve. The challenge is whether or not they're well trained and, even more importantly, well protected. When we're already dealing with shortages on personal protective equipment for our attendings, our doctors who've completed their training on the front lines, to add to that staffing with folks who haven't even had an opportunity to get their first real paycheck. They've invested their blood, their sweat, their tears, their money, hundreds of thousands of dollars, and we've already lost a good number of our doctors in training on the front lines. My ask of programs is that they make sure that they protect our future. The future of medicine is at stake when we put our recently graduating medical students and our house officers on the front line without appropriately training and protecting them. It's just unfair and it's not right.
I appreciate you reaching out to help them, and we'll continue to follow that as you come on to keep us updated. Dr. Yolanda Hancock, I always appreciate you. Your information is so spot on, and we have to rely on your good guidance in our communities. And certainly the communities of color should be paying very close attention to some of the salient things that you were saying. So clear, so precise, and so on time. Thank you for being part of the program today.
It's my pleasure. Thank you for having me and providing this platform.
Absolutely. You're watching The Kelly Wright Show. We'll be back with more after this. Welcome back to the program. I'm going to introduce you to three gentlemen who are very actively engaged in helping the community deal with the coronavirus. Now, they're operating here in the Washington, D.C., Maryland, and Virginia area, which has been hard hit by the coronavirus. But one of the things I want to talk about, as we find this problem going on, and none of us not knowing when it really is going to end, one of the great things we're noticing is the fact that people are willing to roll up their sleeves, even in an age of socially distancing themselves, but not isolating themselves from reaching out to help somebody. And that's what these three gentlemen have been doing. We spoke with Corey Fashon yesterday with Hearts of Empowerment, and what he's doing is really a game changer because he's actually showing people, along with his two colleagues who joined him today, of how they can reach out and actually help somebody right where they are. And so, Corey, if you'll introduce our guests as well, and talk about what Hearts of Empowerment and these organizations are doing to reach out and touch lives right on the front lines of this COVID-19 pandemic.
Yes, sir. I just want to say thank you so much for having us and having me again come back as a guest. And as you said, my name is Corey Fashon. I'm the CEO of Hearts of Empowerment. We also have two other gentlemen on here. It's Robert Banez. He is the CEO of an organization called the Purposeful Unconditional Servicing of Others, also known as the PUSO Foundation. And then we have Chase, who's actually representing two companies, and one of them is Trophy Body PT, and the other one is Mighty Meals, who's the delivery service that we're partnering with.
That's awesome. I want to thank all three of you for being on the Kelly Wright Show. And Robert, let me begin with you. How did you get involved in this campaign to reach out and help people in the midst of this COVID-19 pandemic?
Yeah, well, first off, Kelly, once again, thanks for having us. But to jump right into it, really it was one of those moments where I felt like this was a defining moment for not just us millennials, but our entire generation of humanity right now, with everything going on with the COVID virus, it being a global pandemic. So one of the first things I did was I reached out to Chase. We originally had an event planned for March 28th for us to host a devotion and motion boot camp, but obviously that was canceled because of the virus. And instead I reached out to him and I mentioned, hey, is there an opportunity for us to potentially still be able to partner and give back? And we came up with this idea to essentially give back to healthcare workers on the front line. And immediately in the back of my mind, I knew that Corey and Hearts of Empowerment would be a great organization to loop in. And next thing I know, a few weeks later, we're here on the front line serving as one community and one group all together.
Chase, I want to take a moment and we're going to pause, and I want to show this video that all of you are engaged in. And I think the video speaks very well to your point and Robert's point and Corey's point. So we'll show that right now, and then we'll come back and perhaps go to a break, but I want you to stay with me, and we'll show that video right now.
We want to thank you guys from the bottom of our hearts for helping us reach our goal of $5,000 to bring fresh meals to our hospital staff, our frontline heroes. We've already raised $5,000 and we're stepping it up to a brand new goal.
Thanks to all of our generous donors, so far we've been able to donate over 300 Mighty Meals across 3 different hospitals in the DMV.
Our new goal is 10,000. We're trying to feed every single hospital in the DMV.
Visit our GoFundMe and donate now.
Wow, that's a fantastic video, and it really goes to the heart of the matter, and that's the fact that so many healthcare workers on the front lines facing the COVID-19 pandemic, risking their own lives to save others who have tested positive and are now in the hospital. What you're doing for them is really no small task, and it's a great gesture, not only of spreading faith, hope, and love, but just downright caring about people. I want to start with you again, Chase. What did you feel as a result of doing this kind of effort?
It just feels amazing, honestly, to find a way that we can give back. And I think sometimes these people that are on our front lines are so taken for granted, and they're always living in such these high stress environments, and anything we can do to help them, especially now when it's even more high stress, it just feels amazing to know that we can do something and really hit a lot of different things, support small businesses, support communities, support those in our hospital systems, and know that they have an opportunity to quickly eat. When I was speaking with a nurse, she was saying that they have rules that they can't even be in the break room with someone else and eat in the same place. So they've been eating in their car or do something like that. And when that limits those options, I think it's really nice when they get off their shift, they have the surprise, and they're 2 minutes away from eating a healthy, delicious meal. It allows them to actually take their break and actually have some reprieve rather than spending their whole break scrambling, trying to figure out how to fill their stomach. So just to know that I can give them a little bit of a break to themselves and a little bit of peace amongst the chaos, it feels absolutely amazing.
Robert, I understand Chase's point. When you give someone a helping hand, it does something good for you as well. What do you get out of providing this kind of help to people who really need it?
Yeah, I think personally for myself, I have a ton of members in my family who work in the healthcare industry and are nurses and doctors. So personally, to be able to give back to those on the front line, those that are risking their lives and are brave hearts on the front lines in order to help and save other lives has been huge for me and I think for the entire group. And to be able to do that in a safe manner where we're providing them meals that are not PB&J sandwiches and crackers, but potentially, steak, salmon, chicken, fresh veggies. So I think that really is the root of it all, is to be able to serve, but in a safe manner and be able to impact lives that, are really out there saving the world right now.
Corey, I love what all three of you are doing. I want to take a break, and when we come back after the break, I want to talk to you, Corey, and Robert and Chase about the fact that millennials are actively engaged in doing this. And, it's really important when you can see people proactively engaged in helping others. So when we come back from the break, I want to talk about the millennial involvement in dealing with the COVID-19 global pandemic. More of the Kelly Wright Show right after this. Welcome back to the program. So I'm talking to Corey Fashon, Robert Banez, and Chase. Give me your last name again.
McKesey.
Chase McKesey. I wanted to make sure I got it right. So these three gentlemen, as you've seen in the first segment of this interview with them, are out on the front lines, actually helping those on the front lines who are engaged in providing valuable health care to those patients who have the coronavirus. And Corey, when you enlightened me to this and made me very aware of it, I was just so taken aback to see that this wonderful group of millennials here in the DC area, Washington, Maryland, and Virginia, have actively engaged in creating an empowerment zone of care for so many people in the city. How do you feel about doing this, and what's your message to millennials?
Yeah, so that's a huge aspect that I think people overlook in the nonprofit space is, millennials being active and giving back. And so one of the things that, every individual tries to say is that millennials don't have their life together. How can they help others? They're just trying to get on their own feet. Some of us have just graduated college and that type of stuff. And, we've proven different. The community has really stepped up for us in a huge way. And, whether it's $5 here, $10 here, $20, or even just, time, valuable time that they're able to volunteer, especially with a movement like this, being able to shine light in a space of darkness right now in the world. And it's been really touching to be able to see a community of millennials kind of gather together, backing us financially and with their time in order to, make a difference on these front lines. So it's been awesome.
Chase, what it says to me also is that this is serious, and you're taking it seriously. And rather than just sitting on the sidelines and playing, as some people would do, play video games, stay at home and complain about what's happening politically, you're actively engaged in actually reaching out to touch lives. And so what's your message to people out there? How can they get involved?
It's really simple to get involved. We have a GoFundMe. Everyone knows, most people are familiar with GoFundMe. You can just search Mighty Meals, all one word, and we'll pop up right away. We also have come up with a lot of creative ways, not just going to GoFundMe, but to participate in different events and virtual events that we've created, like a virtual 5K. We've been doing some live workouts via Zoom, just like we're doing this interview. And kind of what Corey touched on with millennials, what I've seen, which I think is really awesome, with millennials, I think of a perfect hybrid. We had a little bit before the internet age, but we're still keen on the internet age and can use it and access it, right? We have a little bit of both. I remember before I had a cell phone and when I was dial-up, but now I'm still in tune with technology. And I think these gentlemen here and the groups that we've been working with have been able to kind of harbor both. So how can we use the internet and technology and figure out ways to be creative enough to hold virtual events per se, but then still translate that to real life application where we're out there and delivering the meals. So it's been perfect kind of hybrid of online and offline. So people can help in any way. And even if you can't donate $1 and you're in these uncertain times, just sharing or liking a post or spreading the message sometimes is even more powerful than a donation. So any type of support goes a long way.
So well said. And Robert, I can't leave without talking to you again. Again, your message to the people of the nation, the people of the world, and in particular, the millennials, because to Chase's point, you can use the technology as a tool of creating a better understanding, a better world, a better environment.
Yeah, I say my message is simple. It's always together as, what binds us together will always be greater than what drives us apart. And I believe with this movement that Hearts of Empowerment, the Puso Foundation, and Eat Mighty Meals, as well as Trophy Body PTS put together, we're all coming together as one group to be able to serve those that are impacted. And I think that it's important for us to reach out to millennials to get involved, because I think all millennials have that great feeling inside that they want to be part of something greater than themselves. I think that's a key part of who we all are and what all millennials stand for.
Robert, Chase, and Corey, thank you for all that you do and for encouraging us today. In this world of darkness, as you stated, Corey, we need to shine some light. Certainly all three of you are doing that with your program. Keep me abreast of what you're doing, and anytime you want to come back on to update us, I'm more than happy to welcome you back on. Thanks for warming my heart personally and showing me that we all can be our brother's keeper and not our brother's killer. We'll be back with more of the Kelly Wright Show after this. Welcome back to the program. So I'm joined now with my next guest, Rodney Foster. Now, let me explain some of the things that Rodney does. I'm going to read his bio. It's very long, so we're going to shorten it and truncate it just for the purposes of the show. But he is a tastemaker, an influencer, and reality star. Rodney E. Foster is a Washington, D.C. native and the quintessential gentleman, if you will, of the East Coast. He's a very astute businessman. He does commercial real estate development, but he's also one of the very few African-American beverage company owners in the world, and is the sole founder and CEO of Edelweiss Wine and Beverage Company. Rodney, welcome to the program today, and it's good to have you on, man. Tell me about your company and how it's faring in this age of the COVID-19 pandemic.
Well, first of all, good morning again, and thanks for having me. And, as we spoke earlier, that I have been seeing an increase in sales because, many people are sitting at home buying wine. I'm getting more social media posts, just emails and just text messages saying, hey, what's the website again? Or is the store near this place where I can go pick it up at, or they just want to know, can I bring it to them if they local? Just people that know me. So have been seeing an increase in it, and which is a good thing because people are buying more wine these days. And I know I read something, I think it was on CNN, that the alcohol businesses jumped like 40% since all this COVID-19 stuff has started.
One of the things you do, you also deal with commercial real estate development, and you work with the federal government to that end. As you know, today, a lot of people will start receiving money from the federal government through the CARES Act. Some 80 million people will be watching money stream into their checking account or savings accounts.
Yeah.
Will that help? How much do we have to do to really help businesses, especially the African-American community, which has business? And a lot of people are concerned that they will not get enough in this particular CARES Act, that they'll have to do another tranche of it, which they are planning to do to help African-American business owners.
Well, as far as, with my business, I, apply for one of the SBA loans that they have out there. So, I apply for that, and just to, help my business sustain while, we're not out in the stores doing tastings or doing some of the other things that I need to do out in the public. So just to sustain my business, I had applied for one of the SBA loans to assist me with funds until, we able to get back to a normal lifestyle.
And are you concerned about that normal lifestyle, if you'll ever be able to get back to it, I mean, you're not suffering any lack of funds, but what about your employees? Will you be able to help them with an SBA loan?
But yes, with the SBA loan, I will be able to help people that, work with me and work for me. So that's mainly what the loan is for. Like for me, I'm okay, but the loan is for the other people.
There's so many African American business owners who are still struggling to make ends meet and just to get over the hurdle, so to speak, in business. Because oftentimes, regardless of what business you're in, it's a make or break kind of business. And
Yes.
just trying to survive is difficult when things are not affected or disrupted by coronavirus. What's your advice to entrepreneurs and business owners who may be thinking, well, because of this coronavirus, I should just give up and throw in the towel?
Well, I've been telling friends and just associates that I know, we have to get creative now because sometimes business is at a halt. So come up with some ideas that you can do to help sell things to make money. Like, if you have things you can sell on eBay or just things in your home that you can sell to generate some income. But we just have to get creative and think about what else can I do in this time to make some extra money. So I've been seeing on social media people who've been doing a lot of arts and crafts that they normally don't do and just getting something done just to generate some income.
I appreciate you so much for coming on the show
I
and
appreciate
giving
having me.
us something to be lighthearted about in the midst of these heavy, difficult times. Rodney E. Foster.
I
Check
appreciate
him out. Where can we find you, Rodney, on the internet?
it. You can find me on Instagram at Rodney Foster, Facebook at Rodney Foster, and Twitter at Rodney E. Foster.
Appreciate you, man. All
I
right.
appreciate you.
When we get together, we'll definitely have a toast.
Yes, I have to get you a couple of bottles as well. So you have my email, so just let me know where to send them to.
All right. Thank you so much, Rodney E.
appreciate it.
Foster, owner of Edelweiss Wines and one of the few African American owners of his own brand. Thank you so much, sir. God bless you.
Thank you. God bless you as well.
All right. Welcome back to the program, and now for my final word. My final word for tonight, again, is encouragement, because that is the drumbeat that we must continually sound. If you watch a good FAMU football game, you know that the FAMU marching band brings it every time. And what do? They encourage you. And this is not a pep rally, but this is an encouraging note, and that is we must help each other get through this. We've seen examples of it in this program. And hopefully, at the end of the day, you will feel ignited and united to keep spreading that encouragement and that love and that freedom and that peace that we so desperately need. Peace out, everybody. Have a great evening.
Kiss me slow, it's the sweetest day.